The last step in the SBIRT process is the RT, or referral to treatment. Treatment is different for many people. Treatment may include counseling and other psychosocial rehabilitation services, medications, involvement with self-help, complementary wellness, or combinations of the above. And for these patients, we need to present this as the standard of care. It must be stated that referral to treatment only takes place in about 5% of the patients that we screen, and that is the 5% at the top of the pyramid that you saw in your earlier modules. Guidelines for successful referral include considering the need for medical detox. Patients that you fear may go through alcohol withdrawal should be referred for treatment. The same goes for patients who may go through opiate withdrawal. If you are on the inpatient setting, many of the patients you see may already be going through this process. Fortunately, most mild to moderate disorders are successfully treated in outpatient care. Inpatient treatment is generally needed for those with mild to moderate disorders only if other risk factors are present. When referring a patient to treatment, we want to use something called a warm handoff. This includes making sure that the language and culture of the treatment facility is congruent with that of the patient. We need to make sure that the patient has the appropriate insurance or can pay for the treatment facility. The location and access must be easy for the patient, and we should assess family support. In addition, the service should match the patient's needs. For example, if the patient needs treatment for opiate use, we should not send them to a referral center for alcohol use. And finally, feedback to main providers is very important. If you are a provider, this includes calling the treatment facility and discussing the patient's case with the referral provider. If you are a nurse, this could consist of an RN to RN patient report. We want to make sure that the patient has an appointment before leaving. We want to talk to the patient and the family about their interest. And we don't want to just give the patient a page of resources. And lastly, we should follow up with a phone call to the patient, inquiring about how their referral process was. Know your community resources. Programs do change over time. Therefore, it is important to have an up-to-date roster of public and private treatment. Linkingcare.org is created by the Office of Behavioral Health. It is a great resource that has things like your screening tools, a provider database, facts regarding many substances, as well as recovery resources. And that is maintained just here for the state of Colorado. For a national treatment facility locator for patients that may need to go out of state, SAMHSA, or the Substance Abuse and Mental Health Service Administration, keeps a website for national treatment facilities, and this can be located at the website on your screen. Common mistakes to avoid when referring a patient to treatment include rushing into action and making a referral when the patient isn't ready. Remember, the spirit of SBIRT is including the will of the patient, and if they are not ready to go, your referral will not be successful. Additional mistakes include referring to a program that is full or does not take the patient's insurance, not knowing your referral base, not considering pharmacotherapy in support of treatment and recovery, or seeing the patient as resistant or self-sabotaging instead of having a chronic disease. Finally, in summary of SBIRT, we want to screen for substance use, and we know that most problems and risks result from moderate or risky use. We want to use motivational interviewing techniques and give friendly feedback. Finally, we do know in that small 5% population that treatment does reduce problem use, and that warm handoffs work best.